if you saw the picture that she brought in, you saw the fat pad has really disappeared from this part of the cheek in that 60-year-old female. So what we're trying to do is we're trying to recreate that fat pad. Now, a lot of people will use, what are they called, cheek implants. But the problem with cheek implants to me is that they're an artificial piece of material that's here, and what they do is they can kind of lift this out, and to me it makes the eyes look like they're more hollow, and you can get a step off, and I think it looks unnatural. And so by doing this, we're basically just replacing the fat pad that's sort of shriveled up. And what we want to do is we want to lift the face up, because what we see is this nasolabial fold has occurred, but one of the main reasons is because this cheek is deflated, and so what it's doing is it's slipping down and creating this crease here. So you can see by doing that, we've already lifted her cheeks up. And I think what a lot of people forget is that you want forward projection. Like if you look at all of you, your cheeks go forward. And we're always looking at lines, but what we really want to do is we want to recreate some fullness forward as well. And so I'm a big fan of also filling in the chin to also bring that forward, as opposed to making these wider. You know, if you keep filling in these nasolabial folds, what you end up doing is you end up bringing the mouth forward like this, which creates a much more chimp-like appearance. And so what we want to do is we want to lift the face up. That's why we call it a liquid facelift. And so we just bring it all along the jaw. Because if you feel your faces, everyone pinch your cheeks, you feel there's a little bit of fat there, right? And if you go along your bone, pinch along the bone. Now, do you have any fat there? You're super, what's that?
That's an orphan.
But do you have fat there? Just go along the bone, right up here.
No.
You have a little bit of fat, do you have a little bit of fat? A little bit?
Not a lot. I got a lot. Very little.
Okay, very little to you. Now you need to pinch our patient's face. Because that is not a little, that's a lot.
Really?
That's a bunch.
Yeah.
Like, yeah, like pinch, who's super skinny? Come over here, Brienne. Get over here.
Feel.
You need to pinch our patient's face. She's actually, no, pinch over here and you'll feel. Now you think you have, do you mind if they pinch you? Pinch right here after pinching. Oh, we won't pinch hard. Do you mind if they just do a little pinch?
Just a little.
Oh, yeah.
See, there's nothing. It's skin on bone. As you get older, it becomes skin on bone. And even those of you, Tiffany, can I pinch your face?
Sure.
See, you've got fullness there. You all have fullness. In our patients that we see, the thin ones, you're going to see that it's skin on bone. And you'll see a lot of times that the fat projects up into the temples. And for her, she has a little bit, but I think that's because of the filler that we've done. But for most of you, except for Brienne, who's, you know, a fitness fanatic, and so she has, what's your body fat?
It's getting up there, but it's pretty low.
It's pretty low. So she'll have a little bit more temporal recession there. But for a lot of attractive people, you look like Tiffany. Her cheek extends up into her bone. Jessica, her cheek extends up into her temple. Ashley, same thing, and you know, so we see that, and Diana's a little bit older, so she's losing it, but you can see how it used to extend up here a little bit. She still has the fullness, but she could actually stand up a little bit more fullness there. But the idea is to bring the weight up in the face, okay?
Yeah, why didn't you fix that when you had the filler?
Well, you know, I think if you look at models though, that are super skinny, they don't have as much fullness, so you have to sort of balance.
No one's accused me of being super stiff.
Okay. So now, I'm sorry we pinched your face.
Oh, that's okay.
Okay, so now the other thing that we have is we have crow's feet here. And one of the things that we can do is we can put in some Botox in here to soften this, or Dysport, excuse me. And with the Dysport, it'll help, but the wrinkles are caused by the movement of the muscle, but also the loss of fat and elastic fibers, collagen and elastic fibers. So we want to just put a little bit of buffer in there too to soften that up as well. And she's really lucky because she doesn't have a lot of hollowness around her eyes. A lot of people will have hollowness, but we're going to fill this up a little bit. Actually, this is Perlane, so let's go over here. Cheek over here. Now, when you're filling, I think it's important to remember that people have hollows in their face. And a lot of what's gone on in the filler world is that people just think that faces should be round. But you have to really start to look at people and see where you have hollows in your face. You know, and if you take away all the hollows in people's faces, they're not going to look natural or attractive. So you want to keep some of that.
YouTube.
And you can build up just along the bone. If you're in doubt, you can just build up right along the bone because that's where you naturally have fullness. So you want to just make it a soft transition between the skin and the bone by having just a little bit of buffer so it doesn't look harsh and hollow. And you see here we brought the fullness up into her temple there. You always want to just check and make sure you're even on both sides. And so she has a little bit more fullness here at this point. You doing okay?
Does anybody have any questions so far?
What makes the crunching sound?
Oh, it's when it's going through your collagen.
Mm. Mm.
Okay, great. Excuse me. Is this, oh, okay. This is
What
great.
I have, which I found out I have, is loop factor 5 Leiden, where I bruise like that. So, I have that little blood disorder. A lot of people go through their whole life not even knowing they have it.
Okay, so now, there's fullness here already because of the numbing solution. She actually has 3 cc's here of water, so that's why she looks really full here. So that's why it's going to look a little bit distorted. So what we want to do is, you can see that most women, when they get past like 35, 40, they start to get the dimpling in the chin. You'll start to see golf balling. And so what we want to do is we want to give a little bit of volume there that softens it. So.
What I also love about seeing the chin is that, when I'm talking to patients and they're looking in the mirror, again, it's, if they're getting an injection, that, patient, you see yourself in the mirror, and I see myself in the mirror two-dimensionally, right? So unless you have mirrors in your bathroom where you pull the sides and you can see different angles, you're looking at me, side profile, 3/4 view. So what looks beautiful to the eye is symmetry, right? So when you look at side profile, where Dr. Jochen's putting the product also on your chin, also balances the face too, right? Because the eye wants to see something that looks symmetrical. I'm calling attention to my face, but where the nose projects out, where's the chin in relation to the nose? Where are the cheeks in relation to there? And then when you look frontal, if you separate the face into thirds, upper third, middle third, lower third. If you look at a baby or a youth, like Ashley, she'll have a distance between the tip of the nose and the top of the lip. That distance is pretty great. But as as someone ages, so our patient, in early 60s, that distance shortens. So what looks aesthetically pleasing is for that to be a little bit longer. So a lot of times patients will look at their lip lines and say, oh, my lip lines are bothering me, and then we're not going to go and just chase the lines. We also want to assess what's the distance look like between the bottom of the nose and the bottom of the lip. So like, I haven't been injected in a while because I've been doing some in vitro work, so I haven't got injected in a while. But you see this line right here? So that's because I haven't had product in a while here. So because my space between the nose and the tip of the lip is shrinking. So putting product there, because I had product in my lips. And Dr. Jochen, I think you even complimented me for taking it out. But
Oh my God, it was too much. Can I interrupt for 1 second here?
Yeah.
Okay, so I think, sorry, no, I'm on a very important site. So,
Yes, yes.
here, so with the eyes, if you look again, you all are youthful, and if you look at your eyebrows, you'll notice that there's no bony, it's not hollow. There's a round surface that goes from like your crease of your eyelid, and it sort of is a round, smooth surface. When you get older, that flattens out, and that's why you start to see these wrinkles around the eyes. And so I think this is one of the places that it's most important to do a little bit of filler. Because I've already filled it in a little bit, but you can see there were creases here. And if we put just a little bit in here and a little bit above the eyebrow, it really softens it and really gives you a much more youthful looking appearance. And this is where people really focus their attention when they're talking to you. So I think putting filler around the eyes is so important because that's one of the places where you really start to age. You know, people talk about their nasolabial folds, but really people aren't looking at those. They don't even care. And if you look at the young people in here, you'll see everybody here has nasolabial folds. What they're seeing is the hollowness around your eyes, the bone showing through, and so we really want to focus in on that area. And you can see here, just by putting that filler up here, see how much softer that looks? I mean, have you guys noticed that at all? It really makes a big difference. And so it's just softening that up, and you're trying to get that bony appearance to really go away. We don't want it to be puffy because we want contour, but we don't want it to look like skin on bone. And so we want to go all the way around the orbit to do this.
Now, is this supposed to actually help with the eyebrow as well?
It does a little bit, but it's just a very little bit.
Okay.
Yeah. And you can see we put it right underneath the eyebrow, and we also put it above the eyebrow, and it just softens the whole area.
Does that help with some crepiness of the lid?
It does.
Okay.
It absolutely does. Okay, so that looks really nice. I'm sorry, Christy, what were you saying?
I was just talking about like what, there's a lot of injectors out there that'll just go straight for lips. So you have to really, as an artist and being in an institution like this where you want to look around the lip area too. So my lips became bigger. Like when you have a patient that looks like their lips come in the door before their body, not a good look, right? And the injector that injects me was too much. So we hyaluronidase my lips out and my cheeks to bring it down.
Is that Fred that did it? Because I was going to say, I saw one of Fred's, and I was like, I walked in the room, and I'm hoping that she was going to other people because it was like, crazy.
Was the cheeks too big or lips too big or both?
All of it.
It was too big. And he's using cannulas, so hopefully that's calmed down a little bit. It's not as much, but that's the thing is you don't want it to look done.
Right.
So we hyaluronidased and started over, so it's less fine and natural.
Yeah, no, it looks natural now. Yeah, it looks very natural.
This is
Okay.
Jody Comp stuff.
Yeah, she does great, and that's one thing I noticed that was one of the things I noticed most when I was there was that she doesn't have people that look really unusual or fake. Now, one of the things I also think is with the nose. Sorry about that. Are you doing okay? We don't want to make the nose big, but we just want to soften it, and so there's just that little buffer between skin and bone. So we just want to put just a little bit in there to make that look fresher. Now we're going to do some line filling. And with line filling, you want to go very superficial in the skin. And I always like to do bevel up because I think it shoots it a little bit higher. Can we bring up the table just a little bit, please? I shouldn't have that tea. I'm very excited. Okay, it looks so good.
Isn't this fun, guys? You get to be in the same room.
Okay, so what we want to do is, if we're doing line filling, we want to go very, very, very superficial. And so what I say is you want to see the gray of the needle if you're doing line filling. So you can see that, and you can see when we get very superficial. Yeah, with the Perlane we can lift and we can volumize, and with the Restylane we can do some lines.
Who can tell me the difference between Restylane and Perlane?
They all the time of the
Not you,
last.
Jason. What's that?
Well, Perlane lasts 9 months. Well, up to 9 months.
What physical characteristics? What's the difference between the two products?
Isn't the Perlane a little thicker than the Restylane?
The particles, the gel particles are actually bigger. So if you think about it, it's the exact same product throughout the whole manufacturing process until the very end. So if you think about a screen like on a window with the holes, so the size of the holes, and when you press the gel through the screen are smaller for Restylane, big holes for Perlane. So you get like M&Ms with Restylane and golf balls with Perlane. So,
The numbing
so
is
just
more
like
now.
Dr. Jochen, he
Sorry.
chooses where he's
You're doing
going to
okay.
put one versus the other. It's
Keep
where
in mind
he
the
needs
product
more
has
structure and
numbing in
lift.
it too, so every time we inject you, it'll get a little bit less painful.
It's the viscosity. It's just more about the particle size, which tempts it up. So if you're putting sand, underneath the house versus you're going to put rocks underneath the house, what do you need in terms of what kind of elevation that you need? So it's the particle size that gives more lift. So Perlane's more ba boom, you know, volume.
Okay, can you see how the line, it makes the lines go away? So now, with the lips, we want forward projection. And so when you get into your 50s, your lips start to flatten out. And so what we want to do is we want to get the lip to project forward just a little bit, because if you look at each one of you from the side, you'll notice that you have a little bit of an angle to your lips. Everybody young, look at each other's lips. Do you see that forward projection? Okay, and you'll notice in older women what happens is their lips start to go down like this. So what we have to do is we have to get a little bit of that forward projection. So what we want to do is we want to sort of TP this out just a little bit to make it look more youthful. You'll see old ladies, their lips are round and flat, and there aren't these what we call filtral columns, these two columns. So they lose all that. So we want to recreate that look.
Why does it go down like that?
Loss of fat, collagen, yeah. You doing okay? And if you don't do the white lip, what will happen is, especially in older women, they'll start to look like ducks. So they'll have this flatness, and then the lips go straight out, and it looks horrible. Okay, so now we need to tilt it back just a little bit.
You want to lay her down too?
Yeah, just bring the table down just a little bit. You doing okay?
I think the numbing's worn off a little bit. It's kind of smart.
Oh, it's okay, sorry. You're tough. Okay, so now we want to do a little bit of line filling in these wrinkles. So what you do is you get the needle in very superficially. You can see the gray of the needle. And then you pull it out. And now we want to just try to recreate a little bit of a filtral column here. So we just do little sticks. And you want to do it at an angle because the column is not really straight. It curves. So you can see they're sort of teardrops. They're not straight on most everybody in the room. See, they curve. They kind of go in a little bit. They slant it. Like,
I thought that
Angela's got the best one because you can see hers goes really, it's rounded, and Brienne's goes in a little bit too. So it's like it's a teardrop shape. It's not two straight columns that go straight down. They slant out and curve up at the top. So some people will just thread it in straight and it looks very artificial.
I know.
So what we want to do is we want to make sure that it curves a little bit so it follows the natural curvature of your mouth. And also, yours is great too. Yeah. Okay, and then we want to get the lower lip to project out just a little bit. Sorry. You doing okay? So we want to try to get some of these little lines. So I'm going to go really superficially into these lines here. Very superficially. Bevel up because you want to push it up against the dermis here. And you can see here she's got a little line, so we're going to just go very superficially. Sorry. Beautiful. Thank you. And then we have one over here. We've got a really deep crease, so if we go very superficially here, we can get in and we can soften that up a lot. Now, with the marionette lines, what's happening is, again, look at our young staff. You'll see that there's actually a little pocket right here of volume right here. It's very full right in this area. And so one of the things that's causing this marionette line to occur is the fact that this fullness here on the sides beside the mouth is actually deflating. So as that deflates, what happens is you get this marionette line or this crease. So a lot of people neglect this area too. So what we want to do is we want to recreate a little pocket right here. So we're going to give a little bit of volume in that side. So it's sort of counterintuitive. You don't want to fill the line, because if you fill this line, what's going to happen is it's going to masculinize the face. And you see it all the time when people are doing line filling. They're not doing volume filling, they're doing line filling. And so when they fill this, what you see is that in women, they'll start to get this squared off jaw, which is a very masculine look. And so what we want to do is we actually want to recreate some volume here to pull it out so that it looks feminine and soft and keeps the tiny chin here with a flare upward like this. So, okay. So let me just do a little bit of this in the labella. Okay, perfect. So she doesn't like this, and you know, this is just volume replacement right here. And how many syringes have we used so far, Lee?
You are at number 4, almost done. You have a little bit in 5 and then you have 6.
And you see here, I'm going perpendicular to the lines here because what's happened is, again, this is a loss of volume that's creating these lines. So what we want to do is we want to refill this area here to make it softer. We don't want to just put in lines because the whole area is flattened out. So we just want to plump up that whole area. And you can see it just looks a lot softer, but it looks, the goal is to make it so nobody can tell she's had anything done. So nobody's going to notice where you've put it. When you do line filling, people will start to see where you've done the filling. So you want to do volume filling to make it so that it's not obvious and it just looks like herself, just softer. Okay? And so we're at 4?
You're at the, you have that little, you have a little bit more now.
No, we're at 4? Okay. Okay, so this is 6. So she's got a tiny, tiny, tiny little face, right? She's got a tiny, skinny little face. We're up to 6 syringes. And you can see she doesn't look puffy, she doesn't look overdone, she doesn't look fake. And so that's the point of fillers, is that they don't go very far. So when we're doing this and somebody comes in and they get 1 syringe and they're like, I didn't see anything. Why didn't they see anything? Because why?
Because it's not enough.
It wasn't enough. I mean, it's nothing, you know. So you know, and everyone has a budget. So I never like our patients to feel bad. You know, if somebody can only afford 1 syringe, it's not that we want them to feel bad about it, but we want them to be educated that 1 syringe really isn't going to do a lot for you. It's, you know, and if that's all they can afford, let's maximize what we're going to do. But level set their expectations so that they don't come back next week and say, it didn't work, I didn't see it, it all went away. We want them to come back and go, you know, you told me it wasn't going to be a lot, you know, so I probably should have gotten more or whatever, but just so that they feel good about what they got. Because you want them to feel good about coming here. So it's education. So now we're going to recreate that little pouch, and you can see that's the reason all these have occurred, because that fullness here has disappeared. It's totally disappeared on her, so we want to give some of that volume back. And like Jessica's perfect, Tiffany's starting to lose a little bit, but you can see Ashley's are still really full in that area. You know, a lot of people, theirs are really full. Claudia's is still really full.
You need a blood marker.
Who does? Who said they need a blood?
Claudia.
I don't know.
What's that?
Sculptra?
And we're going to do sculpture.
Yeah.
Okay, open up your mouth, please.
Hey,
Okay,
Dad.
close your mouth again. Okay, and again, she doesn't have a lot. She doesn't have deep set eyes, but we still want to soften this transition between the thicker skin and the thinner skin. So we're just going to do a couple little drops along the orbital rim here to try to soften this up. And she's lucky because she's so skinny and she doesn't have deep set eyes, and so this will be really nice for her. You know, some people we can use a whole vial on each side just to soften that transition in a lot of people. Now, a lot of people get overzealous when they're doing what they call the tear trough, and they overdo it here. And, you know, if you look at models, a little bit of depression is a good thing. I mean, that's something that's normal, and it doesn't make you look old or anything. So To fill that is again a mistake because it starts to tent people out this way and they start to look very artificial. And I call it the avatar look, where you look like your sinuses are bad or you just don't look natural. It doesn't look good at all. Okay. And then for me, I like to do a little bit of the filling in just these lines here, not to eliminate them, just to soften them, because you know when you're in your 50s, these have been embedded for a long time, and so we just want to just give it a little bit of volume. And now, I don't know, I'm going to ask Christy what she thinks, but do you believe that it stimulates some of your fibroblasts to produce a little bit of lasting collagen?
Yes, there's actually a study done at the University of Wisconsin where they looked at putting lines of placebo, just
Mhm.
saline in some patients, and then Restylane in the other, and they had collagenesis in the patients that had the Restylane.
And is it still the current theory is that it stretches the fibroblasts, and so it's...
Stimulate the fibroblasts to produce collagen again.
Mhm. And you can see this just softens it up, again, because it's skin on bone. So we're trying to, you know, just give a little bit of buffer so it's not skin on bone. Now, the final thing we're going to do is...
Sculptra's right there.
Yeah, we have a really thin patient, and she had a facelift, so this area has become very, very flat. And for her, she's lucky that this, because of the facelift, this isn't sagging anymore. But in a lot of our patients, we'll see that if we just lift it behind, as opposed to putting product in front, a lot of people like to put product in front in what they call the pre-jowl sulcus, this area here, to make this bag not noticeable. But that's a bad idea. It's a really bad idea. Why is that? Does anybody remember what I said?
You get that,
You get the squared chin, and it looks horrible, and it makes women look,
Deputy dog.
and it's really horrible. So you're much better off to lift it from behind, because what's happening is if you pull this up from the back, it's going to look softer, and it's going to look more natural, and it's going to look more beautiful. And it's looking great. You're going to be so excited.
And that's a
I'm so
top
excited.
area of bone resorption is up and in the jaw.
So now, what we do now is, because of all the bruising that, you know, people complain of.
Sorry, she told me to do it. Did I do good?
Sorry.
Didn't she do a great job?
Oh my God, great.
No, just her acting.
What are we doing, doctor? Okay, so what I like to do is I like to sand the tip of the needle. They sell blunt cannulas. I don't love them. I think they're hard to push through. By just doing this, you can get the same effect, but it still will puncture the skin. If you're using the blunt cannulas, you have to use a needle first, and then you have to poke it, and then you have to find it. With this, you're still going to have a blunt needle. It's not going to tear the veins, but it still goes in nicely. And it reduces your bruising by probably 75% just by doing this and not buying those expensive cannulas. And they're also not as they're flexible. They don't bend like the other. I mean, they're really good.
So the cannulas are too flexible.
Yeah, they're too flexible. They don't work well. Okay, so and you can't get them through the skin.
Okay, so now we're on to Sculptra. Who can tell me what's in Sculptra? What's the active ingredient?
polylactic acid.
And how does it work?
It's a biostimulator.
Jason, you should have known that.
No, it was stimulating stuff.
Okay, so we've got
Stimulates
that.
your own natural collagen.
You're doing okay?
Mm-hmm.
You're doing great. Okay, it's going to look amazing. You're going to be so excited.
Great,
I love it when we
thank
can do a
you.
full facial correction because it's like so amazing.
It's so wonderful that you're doing this, thank you.
We would love it if you come back and do an after picture.
All right.
And here you don't, the goal is we don't want to overfill and make this look too round, because what's beautiful about Rhonda here is that she's got those high cheekbones and she's got some hollowness in her cheeks. So we don't want to make that disappear. We don't want to make her look like a pumpkin head. We want the hollowness here, but we want it just a softer hollowness, if that makes sense. And then the other thing I like to do is I like to do a transition into the neck, because again, sorry about that, is it becomes a really harsh transition as we have more birthdays between the jaw and the neck. And if we can put just a little bit of filler in there, it'll make it look smoother and more youthful. So it's all about smooth transition, smooth
I think
arcs.
I like doing that. That didn't feel very comfy.
Okay, it should be a little less.
Mm.
And Jason loves it when I talk about sculptural.
Yes, he does.
Oh, we're talking about it right now. He's doing the hoppy hops, yeah.
Doctor, can you tell the team when you decide to use one or the other, the Sculptra versus the hyaluronic acids? Or when to use them together?
Do I tell them?
The team, yeah. You guys, listen up. So my question for Dr.
Sorry.
Jochen is, and maybe you guys know this answer, is when we use Sculptra versus the hyaluronic acids and when we use them concomitantly. So which areas doctor likes to use them? Does anyone know the answer?
Sculpture primarily he likes to use around the cheek area, close to the midline. He doesn't like using it by the eyes because the lumps are rather low. And the
Sculptra is
temple
like
area
muscle,
too.
right?
Oh, I like the way you said that. Because that's,
muscle?
Does not like muscle.
Oh, does not like
Yes. And what else is polyalactic acid?
It's suture
There
material.
we go. Nice. Testing Jason actually, see if he caught you guys.
We read it.
Oh, Jason did.
Doctor was teaching us.
Jason gave up on us.
We
Let's
read
go
it.
Not true.
Well, that's here, that's what polyalactic acid is. It's vital sutures that are super duper micronized. And it's just like you're gonna make dishes that dissolve, it dissolves, so all that's left is collagen. So that is what gives us all. So it's good, to teach, when you're trying to teach patients what happens.
That's the half. Or the one that.
I'm really hot over here.
This is not going on YouTube, really, is it?
Okay, so not if you don't want it to. Okay, so now we're gonna do the,
Do you guys post on Facebook? This is a cool thing to do on Facebook, like little teaser, like, cause then everybody definitely sees it. If you guys make a snippet with Dr. Jochen, to do a little Facebook post of your video.
okay, squint your eyebrows down hard.
Like that?
Please. Raise your eyebrows up high.
So this isn't a risk with this product Sculptra, but with, potentially any of the hyaluronic acids or radius or anything like that. Who can tell me the difference between a pressure occlusion and a vascular occlusion? Do we know what those are?
What was that?
What's the difference between a pressure occlusion and a vascular occlusion?
I would say a pressure occlusion would be outside of the vein. You could move it around, maybe
Good.
get it, or but a vascular is inside the vessel itself, and it's occluding the vessel.
Correct. What can happen from a pressure or a vascular occlusion if it's left untreated?
Necrosis of the tissue around it.
There we go.
Exactly. So what do you do in a case of pressure occlusion?
You massage until you see the blanching disappearing, and if that doesn't, then you hyaluronic, I cannot say that word.
Hyaluronidase.
Hyaluronidase.
Yeah.
You did great.
What's hyaluronidase?
Thank you, doctor.
It's
The
the
enzyme.
antidote.
Thank you so much for doing this.
Thank you
It's
so
the
much
We'll see you next
for
week,
you doing
okay?
this, yes.
Yeah, it looks great.
Does it now?
looks
It'll
amazing.
be great.
Yeah, yeah, yeah. No, it's
Thank
gonna
you
be
so much
fantastic.
for all your beautiful work.
Oh, yeah, yeah, go ahead and take a look at it. Yeah, you look puffy, you have some swelling going on. But it's gonna
Wow.
soften up, it's gonna look really great.
Thank
You
you
guys see the
so
difference?
much.
What area did you guys like the best?
I think that's
Her eyes pop out there.
All of it, Dr. Jochen.
It looks really good.